Escalating attacks on healthcare in conflict zones, a grave humanitarian crisis. In a chilling escalation, attacks on healthcare workers, hospitals, and clinics in war-torn regions surged by a staggering 25% in 2023, reaching a record high, according to a comprehensive report released by the Safeguarding Health in Conflict Coalition. This alarming increase was predominantly fueled by new conflicts in Gaza and Sudan, while protracted wars in Ukraine and Myanmar continue to inflict relentless attacks on healthcare infrastructure. The coalition meticulously documented over 2,500 incidents of violence against or obstruction of healthcare during 2023, including the gruesome killing or abduction of healthcare workers and the senseless bombing, looting, and occupation of hospitals. These abhorrent acts constitute not only a violation of humanitarian law but also a grave threat to the well-being of vulnerable populations. The report emphasizes the urgent need for national and international prosecutions of war crimes and crimes against humanity involving attacks on the wounded and sick, health facilities, and health workers. It exposes cases of targeted attacks on children's hospitals and immunization sites, leaving communities exposed to preventable diseases. Alarmingly, the report also highlights an emerging trend in the use of drones armed with explosives to target healthcare facilities. Leonard Rubinstein, chair of the coalition and a professor at the Johns Hopkins School of Public Health, decried the appalling levels of violence inflicted on healthcare workers and facilities. He cited instances where workers were deliberately targeted and others where combatants displayed reckless disregard for the harm caused. The lack of restraint we are witnessing, from the very outset of conflicts, suggests to me that the law on protecting healthcare has become meaningless to combatants, Rubinstein stated. The one consistent feature of these attacks is the continued impunity for these heinous crimes. Despite repeated commitments by governments, they have failed to fulfill their obligations to reform military practices, cease arms transfers to perpetrators, and bring those responsible for these crimes to justice, the report charges. The coalition, comprising over 40 non-governmental organizations, has produced annual reports for the past 11 years. In 2023, it meticulously identified 2,562 incidents of violence against or obstruction of healthcare in conflict zones. These included 685 cases of health workers being arrested or kidnapped, and 487 instances where they were killed, nearly double the number in 2022. In countless cases, health facilities were damaged or destroyed by both government forces and non-state armed groups. The report also raises concerns about the increasing occupation or repurposing of these facilities for military use, a clear violation of humanitarian law. Due to the inherent challenges of gathering information from conflict zones, the coalition emphasizes that the figures reported in their study are likely underestimates. The report also sheds light on the devastating impact of attacks on children's health services, identifying 11 countries and territories where such atrocities occurred. Among them were the bombing or occupation of Al-Nasser Children's Hospital in Gaza City, Juwana Amal Center for Children with Cancer in Khartoum, and Kherson Regional Children's Clinical Hospital in Ukraine. The report warns of the cumulative and lasting effects of protracted conflicts, leaving health systems dysfunctional or even non-existent after the violence subsides. Rubinstein laments the profound impact on access to healthcare for affected populations, which persists even after conflicts subside, as witnessed in Tigray, Ethiopia, and Yemen. The destruction or severe damage to the health system, coupled with the departure of health workers, leaves a gaping hole in accessing healthcare, Rubinstein said. He highlights the potential for statements condemning violence towards healthcare by Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, and other officials to serve as a catalyst for concerted global leadership. Rubinstein emphasizes that such leadership must include prosecutions to ensure justice and act as a deterrent. The recent announcement by the chief prosecutor of the International Criminal Court to seek arrest warrants for Hamas and Israeli officials for war crimes is seen as a step in the right direction. However, Rubinstein stresses the importance of prosecuting specific crimes involving the provision of healthcare or misuse of health facilities. "We still have not seen that," he said. Accountability is crucial for these egregious crimes.